Professor Madelena Patricio, you were the past president. You are now the past president of AMEE, and for 7 years, I think you were the president, and a great period of time that was. I know you enjoyed it very much. Tell us a bit what you're doing now. What's your role within AMEE now, with all that experience?
Okay, it was a marvelous time, and I was passionate for AMEE. I think it was such a big challenge, and that period was a very important period, not because of my presidency at all, but because all the members and all the trends in medical education and the way we saw AMEE has changed. So it was the moment where AMEE passed from being an organization already with enormous impact, probably, and as now the one with more impact in medical education, but only offering a conference, okay, the journal and so on, for an organization trying to have a link with the members along the year and developing different sorts of initiatives. MedEdWorld, Aspire, and many other initiatives of AMEE were from that period. So they were conceived, we were engaged, and again, it was not me at all, it was the movement, so it was really a fantastic time.
Yes, I remember you were a fantastic leader and an inspiration to many of us. So looking back though, for 7 or actually 9 years now since you began to be the president, you must have seen enormous changes in the size of the conference.
Enormous. It was in 2006, I think, in, Genoa. And from there to now, I think it's a big, how can I say, it's more impersonal in a way, because there are so many people that in the past, if I had some friends, there was not the risk of not seeing them. Nowadays, if we don't make an effort or arrange a way, I can probably miss some of them. But I think AMEE still was able to keep a kind of way to relate to the members. There is kindness. We offer them, for the ones who came for the first time, for instance, the orientation session, taking care of them immediately, giving them something to drink, explaining what is behind the conference, because it's not easy from the program to know what is going on. And this kind of atmosphere, I think with more barriers due to the big numbers, we still keep at AMEE, and makes probably our meeting a little bit different.
I think that's absolutely right. AMEE still is a happy sort of family, despite being, 3,500 people here this time. But I think you mentioned earlier that AMEE is not just about the group of people who are here, medical educationists and people involved in medical and healthcare professions teaching. There are also important links to other organizations in the world where healthcare is a priority.
Yes, many of them. If I can select some of them, maybe for their importance in the field, we can talk about World Federation Medical Education, we can talk about AMEE, the Association for Medical Schools in Europe, we can talk also with World WHO and many others, and also two that I cannot, and before addressing those ones, we need to talk immediately, is our links with the Students' Association. I think IFMSA, the International Federation of Student Association, and the EMSA, the European Medical Students Associations, are two big pillars of AMEE, and they have given fantastic contributions, not only at the level of running the conference and the group of Students Task Force, but in many issues that we are discussing at our executive meetings. I am surprised with the maturity of the students' representatives and how they put forward initiatives in medical education. I have been invited several times to their general assemblies in both, and I must say, last year, I think it was in Tunis, IFMSA, more than 1,000 students for 1 week with workshops every day. after dinner they stay having shows with television where they discuss education. Unbelievable. So these two for sure, but they are working with us, so I don't mention like external organizations.
No, but that's very interesting and exciting. That's a body of students who are interested in medical education with their own association, who are able to cooperate with AMEE.
And they take a lot from AMEE. They invited almost everywhere people from AMEE to go there, and they are developing. In the past, they had these assemblies or so on, much more to discuss their business. But now they have made of these assemblies opportunities for teaching, I suppose, not only medical education. No, these ones are only for medical education. Yes, fantastic. So I'm in admiration from them.
This is very interesting, isn't it then? So we don't just have in AMEE a large organization of people who are interested in medical education, but we have an organization which has a voice on the international, on the global stage, and can contribute to healthcare problems around the world. And that's, I guess, what WFME is involved with, and the WHO.
With W Federation of Medical Education is for sure so important. It's no need to justify their importance. And what I think I would like to see more, and probably we are changing, and it's easy from our side. We are the bigger ones. So I don't know who is going to see this interview, but anyway, so for us it's very easy to work with the others, and we have to accept that sometimes they may feel discomfortable. I don't know if the word exists. They can be afraid of disappearing if they attach their conference to the AMEE conference. So people that are here paying one trip, one travel, but then if we have another small conference the day after or before, they almost disappear. And I really believe this is not true. I think that each organization, like for example, AMSE, the Association for Medical Schools in Europe, have their objectives and they address the deans. The deans have the powers in the power. AMEE is not, although we have deans with us and we try to put valuable information and expertise to them, is not our major, let's say, or priority audience. So they have specific objectives. So if we all work together, World Federation, AMSE, ASME, and even the words from United States and all around the world, I think we can build a forum of medical education where the problems are the same, the solutions also, and we should be more together.
And from what you're saying, it's possible to do that without becoming a part of a political organization or having a political objective.
And I think we have made a lot of progress and people are accepting much more and things are more defined. And of course, as we heard this afternoon, that AMSE is defining criteria for establishing a medical school, which is such an important initiative. Of course, AMEE should not go on and do the same and so on. So we need to be in touch, we need to share, and together, all together show that what are the new trends in medical education and the ways to, and with WHO, I think is still probably very rudimentary, you say very, but it's essential because what is the aim of medical education if not a better healthcare? So I think we should alert our teachers in the institutions. They all know about their specific field, but I'm not so sure they are aware of healthcare priorities. And there is things that you can teach that are transversal to all disciplines, and you can learn from WHO which are their problems, their challenges, and we can also pass that message to our teachers. And the opposite, WHO can probably learn for us what they could do to support the ones who are training other professionals.
So that's very exciting. AMEE has not only a voice on the international stage, but can be consulted by these well-known and established organisations to contribute to them.
I think
you've got many experiences over the years and happy memories of your time as president. But this year you've developed particular excitement and interest in the hackathon. Would you like to tell us what's that?
I must say that it's my first experience with hackathon, and I cannot talk really about an experience because I was just the first day, and I just have assisted from 5 until 9 o'clock or 10, I can't remember, to the beginning where they tried to get engaged in their methodologies. But what I assisted from, I think they were about 80 or so, or 100, and so quickly they get engaged, they form groups, they define objectives, they go, at the time I was there, were not still linked to medical education, was like a kind of, how do you say, a heater strategy, a strategy they have to make them to get in touch, but then they stayed over the night to discuss their projects, and I think we have very soon, tomorrow or Monday, we will have a jury to judge them, and tomorrow, and then they are reported to AMEE during on Monday, I think.
And these are groups; they weren't just students; they were groups of enthusiasts for e-learning.
Surprised, I think, is that new technique that can be used, and I talked with one student, for instance, from the Imperial College in London, that is using this to solve problems in different areas like diabetes and others. And you put together, as they said, it's not me, people with problems and no solutions, together with people with solutions and no problems, And it's a mixture of doctors, designers, audiovisual people, I don't know, a mixture, all ready to look for creative innovations and go further. But don't ask me to tell much more because I'm really fascinated, but for the moment I cannot tell much more.
Thank you very much, Madelena. That's a wonderful insight into your time as president and some of the new excitements still going on in AMEE. Madelena Patricio, past president of AMEE, thank you very much for talking to us this afternoon.